We are live. We are live. I'm Dr. Frita. Welcome to Medical Monday, where I give you all of the hot health topics in the headlines. We have many headlines today. Starting off with sad news because President Biden has been diagnosed with a very aggressive form of prostate cancer that has already spread to his bones. And so we'll talk a little bit about prostate cancer and what you need to know about when to get screened. And then we will talk about myth versus fact. Yes, myth versus fact, where we talk about what's true, what's not true, specifically when it comes to domestic violence. Yes, we know that the Sean Diddy Combs trial has been in all of the headlines, and Cassie Ventura, his ex-girlfriend, has testified. And many people have been asking the question, why did she stay? Why didn't she just leave if there was so much domestic violence? Well, we'll talk about that. And I'll give you a few myth versus fact statements so we can educate ourselves about what it really means to be a victim of DV. And then we'll get into our weekly dose where I give you a fresh take on the health headlines that you simply cannot get anywhere else. We'll start with Halle Bailey and her alleged DV or domestic abuse from her baby's father. We'll talk about that, how difficult it is to prove, and signs to look out for if you think that someone is a victim of intimate partner violence. And then we'll talk about a case that's really quite amazing. I haven't seen one just like it. A pregnant woman who actually is right here close to home. A pregnant woman has been found to be brain dead, but she's being kept alive strictly to have the baby. And it's not her family's choice. It's the government because it's the law. We'll get into it. And then we will talk about politicians. Y'all know we talk about politicians quite a bit when it comes to health, specifically RFK Jr., because the question is, should you get your medical advice from politicians? RFK Jr. said people shouldn't get medical advice from him. He might be onto something. Tell me what you think. We'll get into it today. And then we'll talk about strokes and how they're becoming more and more common in young people. People less than 45 years of age. What the heck is going on? We'll get into it. And then I'll give you a 5-minute health check where we run through some just important, quick news bits that you need to know about health. And of course, this is live. We have an interaction. I'll ask you questions. You'll ask me questions. We'll have wonderful interaction. Let's go ahead and get started. I'm Dr. Frita. This is Medical Monday. Welcome. This is Medical Monday. I'm Dr. Frita. We are live. Go ahead, give us a like as we get started because I'm about to share with you some evidence-based medicine about the health in the headlines. But I'm not doing it alone. Shador, my office manager and co-host, please come to the stage. How you doing, Shador?
Doing well. How are you doing, Dr. Frita?
I'm doing well. Look, it's kind of a rainy day today. Are you getting rain?
No, we got sunshine over here.
Oh, shoot. Sunshine on a cloudy day. All right. Well, that's good. Listen, anytime it's raining or if I think I feel the clouds, it's time for me to get in the bed and start drinking hot cocoa and watching Lifetime. But I won't do that just yet. I'll go ahead and keep working throughout the workday, starting with right now for Medical Monday. Welcome everyone here on YouTube. Welcome to my good people on Instagram. We did it. We made 50,000 followers. Thank you. And I thank you to everyone here on YouTube where we have over 856,000 subscribers. We're marching toward 900,000. If you haven't subscribed, please do and hit the notification bell so you'll be among the first to know when we release new content. Hey, everybody on Facebook, y'all know we passed 50,000 over there too. We're on the move. We're giving good medical information. And hey, today's no different, Shador. Who was the first one in the chat?
First one in the chat today is Miss Aline.
Hi, Miss Aline. Welcome back.
Welcome back. And shout out to our member, Miss Andrea.
Hello, Miss Andrea. Thank you for being a member. Listen, you too can be a member if you click the link in the description. Our members get, special emojis, special shout outs. I have members only videos that only my members ever will see. And then also members get first look at videos that I later release to everyone else. And my favorite perk is the members only live Q&A, where we spend the entire time with just me answering questions. And for those of you who are new to this channel, the Dr. Frita YouTube channel, I am an MD. I'm a medical doctor who is board certified in nephrology, meaning I'm a board certified kidney doctor and high blood pressure doctor. I have also been board certified in internal medicine, pediatrics, and obesity medicine. And so I like to learn a lot about a lot, and I love to share. And if you're a member, you get special access to me every month with just a members only live Q&A. If you're seeing your doctor and you have certain questions you want to run by me, I'll give you my opinion. If you want to ask even more in-depth medical questions, hey, very likely I have a good answer for you. So come on over, give us a try. We have a good time over here in the members only arena. All right. Now, I'll tell you who's not having a good time. Me, because when we got the news about President Biden having prostate cancer, that really took me out. Already he's been in the headlines, and a book is being released about him and his cognitive abilities and possible cognitive decline. And did Democrats know it? Should they not have allowed him to even start to run? He's really been under the heat. But now, it was announced yesterday that he has a diagnosis of prostate cancer, not just any prostate cancer, a very aggressive form. He has a Gleason score of 9 and a grade group of 5. Bottom line, that just means he has very aggressive cancer that's very likely to spread, and his has already spread to his bones. So he already has metastatic prostate cancer, and it makes me sad. The good news is that his cancer is hormone sensitive. So while typically if a cancer has already spread from the main organ, then surgery is not a typical option, but his cancer is sensitive to hormone therapy, which means it could slow down the progression and give him some more years, hopefully with a good quality of life. But prayers going up for President Biden and his family. And if y'all have any questions, go ahead and put them in the chat, and we'll see how things move today, because we actually do have a lot to get into, and I'll answer some questions. Like if you want to know at what age your loved one should be screened, who's at risk for prostate cancer, what different organizations say about things like the digital rectal exam. Also, I did a short this morning. I did a short form content. It will be available here on YouTube. You can check it out now on Instagram, where I talk about just some things to know about prostate cancer. And I really do get into screening, because prostate cancer is the second leading cause of cancer death among men. And Black men are disproportionately affected. They tend to be diagnosed at younger ages, more aggressive cancer, more likely to pass away from prostate cancer. So prayers going up for President Biden, and just all good wishes, all good vibes. Now, I'll tell you who I'm not necessarily sending good vibes to, and I'm not trying to be ugly, but this Sean Diddy Combs case, as the different evidence is being released, it has the door. It really does. Listen, I want y'all, please put a PD in the chat if you've been following the Sean P. Diddy Combs trial. Put a PD in the chat. And meanwhile, please go ahead and give us the thumbs up, give us the like, share, let YouTube know we're here, let Instagram know we're here, let Facebook know, because we're about to get into some really, really good information that's going to be important for you to know. All right. So for those of you who have been following this Sean Diddy Combs trial, you know that back in November 2023, Cassie Ventura, his ex-girlfriend, some won't call her a girlfriend, some will say that she's someone who was more of a victim even then. That remains to be seen as the trial continues. But his ex-girlfriend, as we call her, Cassie Ventura, actually launched a lawsuit against him, where she accused him of domestic violence. She talked about him putting her in freak-offs where, against her will, she had to perform intimate acts with many different people, including men that were flown across state lines, that very specifically he wanted them to have special appendages, big Black appendages, okay? Men, that's what he wanted. And not only are we taking her word about the domestic violence, we actually saw that tape that CNN released where he was brutalizing her, kicking her, he even threw a vase at her. Okay, we saw that, and he admitted to it in a video. So these things we know to be true. Now that she's on trial, being asked different questions, different text messages of hers between her and him being revealed, you have a lot of people saying, well, why didn't she leave? She stayed for 10 years. She wanted to be involved in a freak off. She must have liked it. Some women like to get hit. You have different people saying these things, and it's driving me up the wall. Let's go ahead and play this clip, and then we'll do some myth versus fact statements about DV.
The prosecution's star witness taking the stand, but it was more than that. It was how Cassie took that stand. You could hear a pin drop when those doors opened, and a visibly pregnant Cassie Ventura walking past a man she had not seen in 6.5 years, a man she says violently abused her for a decade, a man the prosecution said trafficked her. Well, she sat across from him, placed her overcoat behind her, turning her body slightly toward the jury, rubbing her pregnant belly throughout her testimony. Diddy, well, he was more fidgety than he was the day before. He was passing notes. He pushed himself away from the defense table and largely sat like that. They never seemed to make eye contact with one another, not even after she was crying about having loved him once and planning and participating in these freak-off sex parties because she feared him and she wanted to make him happy, but feeling worthless, feeling disgusting because she didn't want to do it. Now, with each moment, the testimony became more and more graphic. Her delivery, though, it never changed. It was matter of fact, steady, calm. At times, she was even critical of herself, walking us all through how a 10-album record deal came over a 10-year period of abuse and sexual humiliation. And once you hear Cassie's testimony, you'll understand why the courtroom was so tense. She described the freak-offs in lurid detail. She testified about Diddy, who she called Sean, choreographing it all. And she explained a pattern of physical abuse that she could not escape. Cassie told the jury about one freak-off at a hotel.
Yep. Shador, has anyone in the chat put PD for P. Diddy if they've been following this case?
Yes, they have.
Who's been
R.
following?
Barnes.
Hello.
Miss Cynthia.
Hi, Miss Cynthia.
Carolyn.
Hi, Carolyn.
Miss Aileen.
Hello there, Miss Aileen. Yeah, it's hard not to follow it, isn't it?
Mm-hmm. Marina said no, she has not been following it.
You know what, Marina? You've probably been protecting your peace, to be quite honest, because, you know, I know how I feel personally, you know, about what I think should happen if indeed what's being alleged, if these things are true. But I'm really being surprised at how many people are blaming the victim, essentially, you know, and not to say that Cassie is a 100% angel. She's, I'm sure, flawed like the rest of us. She's a human being, but it's amazing how many people don't quite understand DV or domestic unsafeness. When people stay, they don't understand. So, well, you know what? Let's go ahead and get into the myth versus fact of things. Let's start with myth versus fact statement number 1. In med heads, let me see where you are in your lining and your thoughts.
All right. First statement. We have 3 statements today, Dr. Frita. So
yeah,
lengthy. All right. Statement 1. If it was really that bad, victims would just leave.
All right. Put an M1 if that's a myth, and F1 if that's a fact. If it were really that bad, victims would just leave. Okay. Put an M1 if that's a myth. Put an F1 if that's a fact. All right, Shador, let's do statement number 2, please.
All right. Trauma experienced in an abusive relationship can manifest years later, even after the victim has left the relationship and seemingly moved on.
Can the trauma manifest years later? Or if they don't say anything in the beginning, year 1, year 2, year 3, and all of a sudden they complain year 10, are they tripping? Okay, an M1 if the trauma, put an M2 if this is a myth, and F2 if this is a fact. All right, third time's the charm. We got statement number 3.
Financial abuse is a common tactic used by abusers to control their partners.
Put an M3 if this is a myth, and F3 if this is a fact about the financial abuse being used to control partners. Now I'm gonna see if any of y'all get tripped up by this, or if you just legitimately disagree with some of the takes on it. All right, pencils down. Okay, let's go back over these statements and see who all participated.
All right. Statement 1, if it was really that bad, victims would just leave.
All right, what do we have? Who said what?
All right, mixed bag on this one.
Ooh,
All right, Marina says a myth.
it's a myth. It can really be bad and victims can really stay. That's what you think, Marina. Okay.
R. Barnes also says myth.
R. Barnes. Okay.
Gospel
it can be very
fan.
bad and they stay. Okay.
Gospel fan said it is a fact.
Gospel fan. If it's that bad, just get up and go. That's what you think, gospel fan. Okay.
Patricia says a fact.
A fact. If it's that bad, go. Okay.
And I remember Miss Andrea, myth.
Miss Andrea said it's a myth. Well, this one's absolutely a myth. Okay. If it's really that bad, people will stay. And this is what's interesting to me, Shador, and I see that, some of our members got it, some of them, Marina got it, some other folks understand that the domestic violence, it's more than just physical, it becomes emotional. And there is a fear to leave. There's a fear to leave. And I'm sure some other people in the chat realize it also. And you may have even seen or experienced people who are in relationships where there's domestic violence that's very, very bad. And they don't leave for many reasons. It could be financial, or honestly, there could be fear. And with the Cassie case, it's put right there in front of us. For any of you who saw that CNN tape where he was brutalizing her, beating her, kicking her, throwing the vase at her, do you know what she was doing? What was she trying to do in that moment? She was trying to leave. She was trying to leave. But when she would try to leave, the violence would escalate. So if it's really that bad, then people will just leave. That's a myth, because an abuser, even before they put their hands on you, will oftentimes get your mind, get that control, groom you, love bomb you, and then take control and make you understand that you need to fear the abuser. We witnessed it firsthand. So this is a myth. And for any of you who think it's a fact, you can come back, please, and share comments. But really, I would love for you to kind of look up domestic violence, look up trauma response, because this is really very important. Yeah, so this is a myth. All right, statement number 2, please.
Trauma experienced in an abusive relationship can manifest years later, even after the victim has left the relationship and seemingly moved on.
What do we have?
So, Duke Cat says a fact.
Fact. Who said it's a fact?
Duke.
Okay.
Cat.
All right.
Sheree.
Hey, welcome back, Sheree. Fact.
Fact.
Okay, it can manifest years later.
M. Stain says a fact.
All right.
And Anton, fact as well.
Okay, so pretty much everyone who participated said fact.
Yes, ma'am.
All right, and you are correct. It is a fact. So the trauma can be going on, and then years later, you still have manifestations. We've seen it, at least in Cassie's testimony. She's now married to Alex Fine. She has 2 beautiful children. She's 8 months pregnant with her 3rd child. Look, she won $30 million combined in suits, $20 million from P. Diddy, and $10 million from the hotel that had the tape of her abuse and did not report it to the authorities. Yeah, they settled for $10 million with her. So she got $30 million. She's beautiful. She's got all the things. And guess what? Even after having a husband, 2 beautiful children, and a wonderful lifestyle, she tried to walk into ongoing traffic to take her own life. Okay, so it's not over. It's not over. She, it sounds like she shared that she's had anxiety and depression. It sounds like she has PTSD. I'm not her doctor. I'm certainly not a psychiatrist, but it sounds like she has levels of post-traumatic stress. And so, yes, years after the trauma, it can still manifest. Y'all are right on with that one. Okay. And remember, you can go ahead and put comments. And if you have comments about this, if you put a DV in front of it, then we'll know that it's a comment, and we'll see how things go and what we get a chance to respond to. All right, let's do number 3 for myth versus fact, please.
Financial abuse is a common tactic used by abusers to control their partners.
All right, what they say?
They are saying, so Nikki says a fact.
Hey, Nikki, financial abuse, common tactic. All right.
Lisa also agrees it's a fact.
All right. Hi, Lisa.
Onika says a fact.
All right.
H. Jones also says it's a fact.
All right.
And
So
Jeanette, fact as
fact.
well. So overwhelmingly
Absolute.
fact.
Okay, very good. Very good. So yes, you are correct. It is a fact. Financial abuse is huge. And so that's another reason when people say, why won't you just leave? Why not leave? A lot of people who are victims of domestic abuse or intimate partner violence, they're controlled financially, and it's typically not an accident. So if you're someone, for example, who is a homemaker and all of the money that you get is pretty much given to you by allowance, if you leave, what are you going to do? You might not have any life skills or job skills. The home might not be in your name. You might not have a right to kick the abuser out of the home. So where are you going to go? Especially if you have family and children, do you take them to a homeless shelter? Those are not always safe. Also, let's just get back to the case with Diddy and Cassie. Sean Diddy Combs signed Cassie to a 10-album deal, which, from my understanding, for people who are in the music industry, 10-album deals, that's not really something you sign. You do 2-3 album deals. He signed her to a 10-album deal. And can y'all name any of the albums? Any 10 albums, 9, 8, 7, 6 albums? Can you? No, you can't. He signed her to that 10 million contract because so then guess what? She's contractually obligated to him for those 10 years and she couldn't sign with anyone else, right? Mm-hmm. So she did not have money. That's financial control. Cassie testified that when Diddy would get upset with her, he would take her passport. He would take her phone. He would take her access away to be able to purchase things. He had financial control over her. Why didn't she leave? What was she going to do? Where was she going to go? And, and just if you look around in your own lives and you may have people of in your family or friends, I hope not. I know of people and I know of patients who really want to leave, have left before, but once they get out there and the financial strain is so real, they go back and guess what? The abuse escalates. It escalates. And so it sounds like, we as a community still have a lot to learn about intimate partner violence. And if you're listening to me and if you are in a situation where you don't feel safe, or if you know of someone, please do call the National Abuse Hotline. So I believe we have that, or we can put that up. If not, I might be able to find it. The National Abuse Hotline.
Okay. Let's see. Yeah, here it is. There's a tickler across the screen here.
Okay, good. Y'all take a look at this and do a screenshot if you need to. Certainly immediately if you're in danger, you want to call 911, but you want to get out of that situation because it's not going to get better. There'll be ups and downs, and it's complicated because that's why they call it the intimate partner violence, because you oftentimes love or have feelings what you think are love for the person who's hurting you, but it really could end not only in emotional trauma, it could end in you losing your life if you're in a situation with domestic violence. All right. Well, thank y'all to my med heads for participating. And, and we'll keep updating you, especially about the Diddy trial, how it relates medically. And I'll tell you, I've already done some posts. Yesterday, I actually did an IG live. So for everybody on IG, I went on and I talked about some medical aspects. Cassie shared that she got multiple urinary tract infections and mouth sores from the freak offs. Okay. And she said that Diddy would still make her be intimate with the different people in the freak offs, even though she had burning pain from the urinary tract infection. She said she had mouth sores from the frequent oral intimacy, and he still made her participate. And so I do an Instagram live. If you go to just yesterday, you'll see where I go into details about UTIs, the differential diagnosis. I talk about STIs. I talk about mouth sores. And yes, a mouth sore could be caused from very intense, frequent oral intimacy, but there's some STIs that can also present as mouth sores, specifically syphilis. It can present with a painless chancre or a painless sore ulcer on the tongue or on the mouth. So I talk about HPV, oral cancer, all of those things. So I get into some details, so you can check that out. I posted that yesterday. And then I also, in keeping up to date with the medical aspects of the trial, I posted a reel and some short form content. You can see it on IG and on Facebook for sure, where I talk about the science behind stress and pregnancy. Because again, Cassie is over 8 months pregnant, and she's sitting here being forced to face the person who allegedly caused the trauma, not even just allegedly, we saw him cause the physical trauma, at least when he did the physical, he was physically violent towards her. So she's sitting there pregnant. So high stress can cause you to have potentially a child preterm, which is before 37 weeks, or it can cause you to have a child who has a low birth weight, less than 5 pounds, 8 ounces. So bottom line, just check me out at Dr.Frita on all social media platforms. I tend to keep medical information coming about the headlines as they pop up, things you'll find useful to share with family members. All right, go ahead and give us a like if you have not done so. Share us as we get into our weekly dose, where I'll give you a fresh take on the health headlines that you simply can't get anywhere else. Oh dear. Let's start with Halle Bailey. Okay. Y'all, you know Halle and Chloe Bailey, the sisters, who are beautiful young ladies, highly talented. They are in the headlines sometimes quite a bit for some controversial things. I think that we were all excited when Halle Bailey got to be Disney's Little Mermaid, okay, a Black Little Mermaid. Very excited about that. Soon thereafter, she became pregnant from someone who is a YouTuber in a different realm, but apparently, reportedly, from Halle, he has not been the best partner. They do have a child together now, and according to Halle, he is not consistent as far as the schedule. He'll just come when he feels like, demand the child, things of that nature, does different controlling gestures. So this she's been sharing, we've watched it throughout the relationship, but things have escalated, at least in the public eye, because now Halle has alleged that her baby's father has been physically violent, and she's even taken photos of the bruises. She reports that when she went to do a baby exchange, he was very angry, and that made her concerned as far as leaving her son with him, with the son's father. And he cursed her, called her the B word, took her phone, threw it, things of that nature. And according to her, he physically attacked her. She also reports that he has gone into her home without her knowledge and without her permission. He's taken a picture of her bed and said, now I see what you're on. I see what you're on, which is an implication that, okay, I see you're in here sleeping with other men. That's how it seems to me. And that's how it's been shared, in the media. So basically she's dealing with someone reportedly, allegedly, who's physically abusive, controlling, psychologically abusive. And she actually requested a restraining order, which I believe was granted. Well, now she's taking it to the next level. There's a movie that she is contracted to be filming in Italy, where she'll be there for 8 weeks. And so she's asking to be able to take her child with her, her nanny, family members, other support, to be able to take the child, without any interference from the father during those 8 weeks. But if you could just show the clip, I believe we have a clip of the bruises on her body, of Halle Bailey's body.
Yes, a photo of her the bruises and a chipped tooth, it seemed like.
Oh, shoot. All right. So now I want to ask you, to my med heads, to everyone in the chat, and to those of you who are going to join us in the replay crew. Hey, replay crew. I want you to tell me, what are some signs of someone being physically abused? What are some signs that we need to watch out for? Yeah, if y'all can go ahead and put those in the chat, that will be wonderful. And I'll tell you, while you're putting that in the chat, going back to the case with Diddy and Cassie, now that they go and pull up old pictures that we've seen of Cassie on the red carpets, you can see different times where she had bruises on her arms and even a black eye. He once gave her a black eye, according to Cassie in her testimony, right before she had a movie premiere, and they used makeup to try to cover up the black eye. But there's some angles where you can actually see it. You can actually see it. And, she talks about where he would lift a frying pan, and that would, cause her to have great fear. And when she was asked how many times Diddy was physically violent towards her, she said too many to count. She just didn't know. Yeah. Has anyone put any signs in there? If not, then I'll go ahead and I'll just share some of the signs.
Yeah, Miss Aileen put some signs, and Miss I Am Paralegal also shared.
Oh, great. Okay. Miss Aileen.
Miss Aileen said bruises would be sign.
Absolutely. And bruises. So whether it's a black eye, bruises on the arms, bruises on the face, and really key with that, Miss Aileen, is the story of how it happened. Oftentimes, the story is not going to correlate with the bruise. Like they might have a black eye and say, oh, I ran into a wall. Well, a wall is not going to neatly fit the socket of your eye to cause you a black eye, right? Or if they get nervous or seem like they're stuttering, that the victim. So yeah, so looking for bruises.
Yeah.
Okay.
I am paralegal shared with DV. She has two stories. I worked in 2 JAG offices, and I've seen how abusers treated victims in front of others. Victims are scared to stay and scared to leave. And she also says, plus as an abuse survivor, my ex told me that he'll end me, my parents, and my siblings if I left. Once he went crazy when my 3-year-old, when he didn't do all his math, I had to get my kids away.
Oh,
so she's experienced it herself, and she worked in offices where she's experienced it as well.
Oh, I am paralegal. Thank you for sharing. I always love it when you come and join us. So thank you for sharing your story. And I guess that's made you really kind of keen and acutely aware of when you see it. And so what you said was powerful. I am paralegal. They're scared to stay and scared to leave, especially, if there's a threat. If you leave, I'm going to end your life and end the lives or hurt the people you love. And so that's why. So I am paralegal. Are you as baffled as I am when people keep saying, if it was that bad, why Cassie ain't leave? Why she ain't leave? That's why. So I'm sorry that happened to you. And I'm so happy that you have survived it. You lived to tell the story. And even just your sharing here is going to touch someone and hopefully give them the strength to reach out for help. Yeah. Scared to stay and scared to leave. Yeah. And not to mention, sometimes you actually have a love for the person, right? Like, it's not like you absolutely hate the person who's perpetrating the violence. Sometimes there are probably some good moments or some remember when. And so it's not black and white. Yeah.
So thanks for sharing. I am paralegal.
Yeah. Some other signs. So
some people chimed in before you
tell
it all. Yes,
okay, come on, y'all. Y'all know me. This mouth right here will go ahead and run it on down. What else you got?
Ms. Gwen says verbal abuse.
So it's not always the physical, it can be the verbal, and the verbal is oftentimes a pre-escalation, right? So and I think about what Halle Bailey alleges about her baby's father, or we calls her a B, just kind of calling someone a degrading name. That just kind of is almost like a pre-escalation, or telling someone that they're not anything. You ain't, you won't be anything without me. Insulting someone's appearance, trying to make them lose confidence. You look at how physically beautiful Cassie is, right? Arguably, one of the most beautiful people, as far as her look and being commercially attractive. It is the abuser's goal to break you down and to take that light from you. And so you feel low. You feel like nothing. So verbal abuse definitely is one of the signs to watch out for. If you hear someone being verbally abused, the question is, are you also being physically abused? Both very bad, of course. Okay.
All right. Marina.
Hi, Marina.
I see that the partner always does all the talking when questions are asked.
Oh, Marina, you just made me think of something. Listen to me. So when I did my internal medicine pediatrics residency, my bed peds residency at Georgetown University Hospital, I remember working in the ER, and there was a beautiful young lady in her 20s. She looked like a model, and she came in with a complaint of stomach pain, and she did have some subtle bruises on her. And in questioning her about the bruises, her story didn't seem to make sense, but her boyfriend answered all of the questions. He answered all of the questions, and he did not want her to be left alone. And, we're trained as physicians, healthcare providers, when you suspect abuse, what you want to try to do is get the suspected victim away from the suspected abuser. And so I was like, I'm going to go ahead and get her changed into the exam. If you don't mind stepping out. Babe, is it okay if I stay? Yeah, I can stay. Okay. So then I remember having to get tricky. And when it was time for us to take her to get some x-rays done, then we just said, you're not allowed to go, right? They're allowed to go sometimes, but he wasn't allowed to go. So that's when I was able to get my good questions in. A lot of questions she didn't answer. She got tearful. And so I knew. But what's really difficult is without the cooperation of the victim, there's not a lot you can do, right? If the victim is still protecting the abuser, if the victim is scared to leave, even in a hospital setting, there's not a lot you can do. And so there are many cases of domestic violence I've witnessed and I've seen. But yeah, the abuser answering all the questions. Ooh, that's a big one. That's a big one.
Yeah. Yeah.
That was
Ms. Aileen said isolation.
Isolation. You got it. Isolation. Not only physical isolation, okay, where they might try to move you away from your family, right? Say you don't have a whole lot of transportation, you don't have a car, they move you from that support, but then also they try to mentally isolate you. Ooh, I know I've witnessed this. Case in point, if you have an argument with a family member, with your mother, with your sister, whichever, with your support system, people have arguments, but an abuser will jump in there and try to make it seem like the end all. See, you see how your mama talking to you? You can't count on nobody but me. See, your mama don't treat you right. Getting in your head when you're at a vulnerable state. Your best friend, you have an argument with your best friend or someone else who they know is a support for you, trying to get in your head to isolate you or trying to keep it where you can't visit your friends, right?
Mm-hmm.
Why you want to be with them? You got me now. You all the time run off to your friends. You don't love me. Trying to make it so they put a wedge between you and relationships. Isolation. You hit it. That's
and on that topic, Anika, she says my friend was in a DM relationship and she never wanted me to visit her home. One day I got to visit and we were having a good time, and then all of a sudden she looked at the clock and rushed me out.
Wanted you out before he got there. Probably didn't want you to witness how he might talk to her, assuming it's a male, a him, how he might talk to her, how she might flinch or be uncomfortable, just kind of always on edge, not wanting you to say anything that might upset him. Yep. All right. So y'all have hit on really the big signs. So the physical signs like the bruising, the isolation, the partner always talking. Another thing, if you watch them, if they kind of jump, if little things make them jump, like if their partner's there and maybe their partner's just, reaching for a glass of water, but when the partner's hand goes near them, they jump. That could be someone who's used to being hit when that partner's hands touch. Okay, that's something else. Yeah. So just pay attention, watch out for signs, and check on your strong friends, because there really is no stereotype of the person who's a victim, right? You can be a high power executive, bad boss at work and go home and be abused. Okay. So the signs of abuse are not just for people who you think might be of weaker personalities. Check on your strong friends because they could be victims of domestic violence as well. Oh, medheads, y'all were on fire today. That was a real good discussion. All right. So now we've talked about Halle Bailey and her baby. Let's talk about someone else who has a baby with a story that has a bit of a complication to it. There is a pregnant lady who is now brain dead, but she is being kept alive for the baby, not by her family's choice, but because of the law, the heartbeat law. Let's play this clip and then we'll talk about it.
Tonight, a Metro Atlanta mother lies brain dead in a hospital room, being kept alive only because she's pregnant.
So her case is now raising a lot of new questions about Georgia's controversial heartbeat law. Adriana Smith's family says they've been forced to wait without a voice while doctors try to keep her body functioning long enough to deliver her baby.
11 Alive's Cody Alcorn is live outside of Emory Midtown, where Adriana was just moved hours ago. Cody, what have you learned about what's going on here?
Well, Jennifer and Ron, Adriana has been on a ventilator for the past 90 days. Now, as you mentioned, she was moved here just hours ago, so doctors can deliver her baby when it is time. Her family visits her every day, including her young son, who believes his mom is just sleeping. A crushing emotional toll, as you can imagine. The family says it's been made worse because they have no say on what happens next. 30-year-old Adriana Smith was about 9 weeks pregnant when she started having bad headaches in February.
Enough to know that something was wrong.
April Newkirk says her daughter went to Northside Hospital for help.
They gave her some medication, but they didn't do any tests. They didn't do any CT scans. If they did, they would have caught it.
The next morning, Adriana's boyfriend noticed something was terribly wrong.
She was gasping for air in her sleep, gargling. More than likely it was blood. She was taken to Emory, Decatur, and then she was transferred here.
to Emory University Hospital, where Adriana worked as an RN. Unfortunately, there was nothing doctors could do.
They did a CT scan and she had blood clots all in her head. So they had asked me if they could do a procedure to relieve them, and I said yes. And then they called me back and they said that they couldn't do it.
Doctors declared Adriana brain dead.
So I feel as if somebody dropped the ball at the hospitals, and her boyfriend asked.
This story got me real bad, Shador. It got me real bad. So we're going to talk about the Georgia heartbeat law. And as I talk about it, I want to ask all of you in the chat, the replay here on YouTube, IG, Facebook, do you think that it is right for the government to make the decision on keeping this brain dead lady's body alive and forcing her to carry this baby, and the mom has, the patient's mother has no say, the patient's boyfriend has no say? Is it proper? And so what I'm talking about is the Georgia heartbeat law. So at this time here in the state of Georgia, where I am, and I'll just go ahead and tell y'all, they say she's been transferred to Emory University Hospital Midtown. That's where Shador and I work. Okay, so this really hits home. I'm not involved in her case. I'm not involved in her case at all. What I'm talking about is strictly what's being shared publicly and in the media. But this really hits home. So right here in Georgia, the Georgia heartbeat law states that if a fetus's and unborn child's heart can be detected, then you are not allowed to have an abortion. You're not allowed to terminate the pregnancy. Well, in this case, Adriana was 9 weeks pregnant when she became brain dead. But now the decision is not in the family's hand, it's in the government's hand. They will not allow her to be taken off the ventilator. She is not alive. She's brain dead. And I'll talk about what that means. But they are keeping her body alive to have the baby. But here's the issue. The family is still getting medical bills. It's not their choice to keep their brain dead daughter alive, the daughter who they would never, ever have another interaction with. You know, she will never talk to them. When the ventilator is removed, she'll stop breathing and her heart rate will stop. Okay. Don't worry about that. Can y'all hear that? Shadow and Nico?
Yeah.
Those are my guard dogs. All right. Amara, I'm doing my live. All right, we got a lot going on. Anyway, so yeah, so her daughter is brain dead. Okay, it's not like she's coming back or will ever have any interactions. That is a scientific fact. We'll talk about that. She's still getting the medical bills. The mother is, for her child. And if something happens to the child, if the child has some type of abnormality, if the child has some fetal complications, if the child is born blind, born disabled, all of those things, because having a mother who is simply acting as an incubator, a body being kept alive, there are complications that can occur. But the choice has been taken away from Adriana, the brain dead young lady's hands. It's been taken away from her, taken away from her boyfriend. The government is completely making the choices. The mom is still getting the bill because of the Georgia heartbeat law. So yes, please put in the chat what you think. Do you think it's proper for this decision to be in the hands of the government? And if so, let me know if you have any nuance. If the government is going to make this decision that perhaps the mother would not have made, should the government foot the bill, the medical bills? Or do you agree, hey, the child's alive, by force, you should have to keep your daughter alive. Although she's not alive, she's brain dead. Okay, so put that in the chat and then let's talk about what to do. No, just leave them in. Oh, hold on, y'all. Listen, that's a person for upstairs. Okay, go ahead, get the door. All right.
All right, Miss Aileen and Duke chimed in. Miss Aileen said, no, I don't think they have the right to make the decision.
Okay.
And Duke says, nope, that's the family's decision.
The family's decision. Yeah. And it's really something. The mother brought up a point. She said that the mother said that there's a possibility that she might even keep the child. Mm-hmm. It might have been her choice to keep the daughter's body alive, even though she's brain dead. But she doesn't appreciate that she has no voice. She has no voice at all. And so she goes in and Hold on, y'all. Hold on just a second. All right.
All right.
Okay. Yeah. She said, maybe she would have made the decision for the baby, and kind of figure out the pros, the cons, the risks, the things of that nature. But the fact that it was taken out of her hands due to the Georgia heartbeat law, she just doesn't feel like it's right, the mother. And again, she's getting all the medical bills. And if something happens and the child is born with complications, who is going to be the one to raise the child? And the mother, when I say mother, the mother of the brain dead pregnant young lady, Adriana, she's saying, no, not that she has a problem taking care of grandchildren, but it's the fact that it was just taken totally out of her hands, right? If the child, God forbid, is born being disabled, it will be her and Adriana's boyfriend with no choice. So yeah, I actually believe the choice should be in the next of kin, the mother's hands as well.
Yeah. And Ms. Gwen, she says the government should be held accountable for her medical bills. Otherwise, the government should not be involved at all with what what the family decision is.
I agree. And in my agreeing with you and agreeing with Miss Aileen as far as it being her choice, that has nothing to do with being pro-life, anti-life, pro-choice. It's just, it's just what makes sense to me. That part is my opinion. It should be the family's choice. She is brain dead. And when I say brain dead, let me just tell you what I mean. Being brain dead is a condition where one's brain has completely irreversible and total loss of function. Okay. In the brain and the brainstem. So that means not only is the person unable to think or talk, they're also unable to breathe on their own. Their heart won't beat on their own. They can't sneeze on their own. They can't cough on their own. Complete irreversible loss of function of the brain and the brainstem. If they were to take Adriana off of that breathing tube, her whole body would go. Okay. But by them keeping her on the ventilator and keeping the tissues, quote unquote, alive, keeping her heart beating, keeping her blood circulating, then that's artificial means of keeping her alive. But the brain and the brainstem are gone. So she is brain dead. And just to put it into a perspective that makes sense for those of you who've been here and who followed me for a while, we talk about transplantation. People who are organ donors, if they become brain dead, then they're oftentimes kept on a ventilator just long enough to be able to harvest the organs. But the brain is gone, the brainstem is gone. How do you know? You do an apnea test. Okay, you take them off mechanical ventilation, they won't breathe on their own. Heart will stop, everything will stop because they are brain dead. They're not there, they're not alive. And and look, y'all taking me with trips down memory lane when working in the hospital as a resident. So like at Georgetown, again, when I did my med peds residency, at nighttime, you're the only medical doctors in the hospital. The attendings, the supervising physicians get a chance to go home, and the residents, the doctors in training, we are officially MDs, we're medical doctors. And in order to declare someone dead, the medical doctor has to do it. And so a part of my job would be to get calls like from nurses. And of course, nurses are very smart. They know the person is not alive, but officially the call has to be made by the physician. And so some ways to know that a person is not alive is, first thing you do, you go in and you kind of scream the person's name, hey, Mr. B, so they don't respond to auditory stimuli. And then you do a painful stimulus, like you take your knuckle and you rub in the breastbone, you rub in the sternum, no response to pain. Okay. And then you take a soft cotton swab in the eye to see if they have a blinking reflex. Because if you ever played that game, like in science as a kid, you could hold like a clear something in front of your face, and then the science partner will throw something at you. So logically, you have a clear shield in front of your face, but still you blink. That's a reflex. But a person who is not alive, they won't respond, right? And so you also take your light, you flash to see if they have a pupillary response. If the pupils, a dark spot in the center of your eyes, if it gets small, yes. But if they're not there, then especially, if they're brain dead, the pupils will not respond. And in the case when someone's on a ventilator, you do the apnea test. You stop the mechanical ventilation, okay? You stop the breathing machine. And if they don't breathe over that machine, and along with all these other things I listed, this is how you declare a person as not being alive. So when I talk about, brain dead and we're talking about what it means, I know firsthand, because as physicians, you are the ones who you have to go through all of these things. And, the body temperature needs to not be cold. It needs to be at least at a normal body temperature. Mm-hmm. So in this case with Adriana, she is brain dead. She is not alive, but her family's being forced to keep her alive for the pregnancy because of the Georgia heartbeat law. You cannot terminate a pregnancy if a heartbeat is heard. And so she was 9 weeks when this happened. Now she's 21 weeks pregnant. And so we'll keep you updated on what happens with this story. But yeah, this one's a tough one. All right. I have another question for you. Should you trust politicians to make your medical decisions? You know what I say. RFK Jr. is back in the headlines, y'all, because he's still spreading misinformation. He talks about, vaccines and the dangers of vaccines, even the ones that have been safe. I thought that he said one thing about the MMR vaccine. He did say that it was the best way to prevent measles, but then when asked if people should be recommended to get measles, now that we know there are over 1,000 cases, we've had deaths. 2 of the deaths have been in children who are unvaccinated. He's like, I don't know. And then he goes on to say that he doesn't think that people should get their medical advice from him. I agree, because he's not a doctor. He's not an MD. He's not a scientist. He's not a nurse. He's not a PA. He's not a nurse practitioner. He's not qualified. But now he says it also. Let's play this clip and let me tussle with RFK Jr. again.
Heated comments on Capitol Hill. Health Secretary Robert F. Kennedy Jr. grilled today about why he won't clearly say the measles vaccine works and saves lives, particularly with children. And at one point, Kennedy, who is the health secretary, surprised some in the room when he said, "I don't think people should be taking medical advice from me." Here's ABC's Rachel Scott.
Tonight, Health Secretary Robert F. Kennedy Jr. in the hot seat. Lawmakers asking the noted vaccine skeptic whether parents should vaccinate their children against measles.
Come here.
An alarming outbreak across 30 states.
I don't want to seem like I'm being evasive.
Yeah.
But I don't think people should be taking medical advice from me.
But senators pressing forward.
Are you actually still recommending people get the vaccine, or are you not?
Senator, if I advised you to swim in a lake that I knew there to be alligators in, wouldn't you want me to tell you there were alligators in it?
So are you recommending the measles vaccine or not?
What I've said and what I said,
It doesn't sound like you are. Are
you going to let me answer? Are you going to keep it?
Are you or are you not?
Are you going to let me answer? I am not going to just tell people everything is safe and effective if I know that there's issues. I need to respect people's intelligence.
You're answering the question. I think you're
And
answering
the reason
That's
that
really
people-
dangerous for the American public and for families.
The fact is, the measles vaccine is considered safe. 3 people have died in the current outbreak, including 2 children, all of them unvaccinated. The Republican chairman of the Health Committee, who is also a doctor, correcting Kennedy today after the secretary claimed most childhood vaccines have not undergone rigorous testing.
The only vaccine that has been tested in a full-blown placebo trial against an inert placebo was the COVID vaccine.
The secretary made the statement that no vaccines except for COVID have been evaluated against placebo. For the record, that's not true. Rotavirus, measles, and HPV vaccines have been, and some vaccines are tested against previous versions. So just for the record, to set that straight.
Kennedy also grilled on the sweeping cuts across his agency. 20,000 employees now gone, including lead exposure experts, set to fly to Milwaukee, where students at several schools have been exposed to dangerous lead levels.
All right. What's your answer to the question, good folks in the chat? Should politicians be trusted to make your medical decision? Now, granted, he's the head, RFK Jr., of the Department of Health and Human Services, but even he said that he doesn't think that medical advice should come from him, which then begs the question, what is he up to? I just get frustrated because, as you know, here on this channel in my everyday life, I promote evidence-based medical information. Evidence-based medical information. When you start getting into the woods, it gets real dangerous real quickly. And who suffers? All of us suffer, but mainly people who don't have access, mainly people who have socioeconomic stresses. So please put in the chat on what you think as far as should you get your medical advice. And, you know, if RFK Jr. is not there to provide evidence-based medicine, then is he doing more harm than good? I think so. I think so. There are plenty of people who are, you know, physicians, scientists who could have been chosen for this position. And, you know, and we know that RFK Jr. was originally running for president. First, he reportedly called Vice President Kamala Harris to try to kind of get a deal with her. She wouldn't take his calls. And then he went to President Trump and reportedly, you know, they worked something out. And now you have him here in this position. But it's dangerous because he's spreading misinformation. So just make sure for everyone who's listening to the sound of my voice, you do your own thinking, talk to physicians you trust, look at the websites like the CDC, American Cancer Society, American Heart Association, National Kidney Foundation, different trusted organizations, and really make sound decisions based on the evidence. All right. So we'll see if anyone comments on should you listen to advice from politicians, and then we'll keep moving. So they commented already.
Yeah, they have. So a couple from IG. Hey,
IG, welcome IG. Listen, y'all check out my IG live. Yeah, I get into some details. about UTIs, mouth sores in relation to the Sean Diddy Combs trial and Cassie. You don't want to miss that one. You should share that one. Mm-hmm.
All right. So on IG, Jay and
Hi,
Lady
Jay.
Merlot both say no.
Yeah, not listening to the politicians, making your own decisions.
Facebook, Augustus chimed in and said no.
I know Augustus. Hey there. Welcome from Facebook.
I am paralegal. She says no. Politicians, regardless
Hold
of party.
on. Let me get ready. I know I am paralegal got something to say. All right, I'm ready. What'd she say?
No, the politicians, regardless of party, should make uninformed decisions for our lives. I trust AI before trusting a politician who's never graduated from medical school.
Thank you. And I like that you put that. It's not just a partisan thing, right? I'm telling you, regardless of the party, independent, Democrat, Democratic Party, Republican, if you're not practicing evidence-based medicine, I will wear you out because you're hurting the people. She said, I'd rather trust AI, and that's real scary. I am paralegal.
Miles, I can't pronounce your first name. I'm going to go by your last name, which is Miles.
Spell your first name.
E-U-G-E.
E-U-G. Is it Euge? Give us a phonetic spelling. Euge? Or is it short for Eugene? Anyway, what you got to say here?
Politicians should not be making medical decisions, especially if you are not licensed.
Thank you. Like no credentials. That's what's wild. If you're a politician who happens to also be an MD, DO, nurse practitioner, scientist, PhD, something like that, okay. But not only are you not credentialed, RFK Jr., you're also spreading gross misinformation. So yeah, I agree. Look, I'm thinking that maybe they wouldn't really weigh in. They have a lot to say, especially I am paralegal. All right. Let's move quickly into this last story, and then we'll do the 5-minute health check. And if you have a couple of comments or things that are must do's, then we'll see if we have time for them. But for this story, this is very upsetting. So May is Stroke Awareness Month. Okay. Hello, May. May is Stroke Awareness Month. And one thing that's happening is strokes are increasing in young people less than 45 years of age. Let's play this clip. Let's talk about it. And for those of you in the chat, I want you to put different reasons why you think strokes might be increasing in young people and what we can do about it.
GMA Health Alert. May is Stroke Awareness Month, and while most people think of strokes as something that affects older adults, the latest numbers show a troubling rise among young people. Chief Medical Correspondent Dr. Tara Narula is here to explain all this. Good morning, Dr. Narula.
Good morning, George. That's right. Doctors are seeing more strokes in patients under 45, and the reasons may surprise you. You're about to hear from two young women, both in their early 20s, who never thought it could happen to them. Here's their story. This morning, the number of young people experiencing strokes is on the rise.
You hear about it, but you just never think this is going to happen to me.
Last April, at just 23 years old, Ann Folk was folding laundry at home when she felt half of her body go numb.
Half of my body was totally immobilized on the left side, and on my right side, it felt like as if I was having a seizure that was uncontrollable. And then I also had a very severe migraine in my head as well.
After a friend called 911, she was rushed to Endeavor Health Northwest Community Hospital in Chicago, where doctors confirmed she was suffering from a stroke from a blood clot on the right side of her brain. For Aubrey Hasley, she was just 22 when she too had a stroke last June.
I had really loud ringing in my ears for a couple of seconds. And I guess it kind of freaked me out because my balance was so off and I was just falling over anytime I tried to stand up.
Aubrey receiving care at the same hospital, doctors performing a thrombectomy to remove a clot. While most strokes still affect older adults, the latest CDC data shows a sharp increase in stroke-related hospitalizations for people under 45. One recent report indicating a nearly 15% rise over the past decade.
All right. So yeah, the strokes are increasing in younger people. Do we have anyone who commented on why they think strokes might be increasing in younger people? And just remember, in general, stroke symptoms, think BFAST, BEFAST. If you have B, balance issues, okay, you lose your balance. E, eye problems like blurry vision. F, facial weakness or facial droop. A, arm or leg weakness. S, slurred speech. Then T, it's time to call 911. Be fast. These are just some general symptoms to look out for, some general signs and symptoms. A lot of times people go wrong when they kind of sit and make excuses for the symptoms. Maybe I slept wrong. Maybe it's my nerves. Oh, maybe I need new glasses. Forget all of those excuses. Time is brain. And so if you're suspicious that a loved one is having a stroke that you're witnessing, or if you're getting these symptoms in yourself, go ahead, activate emergency medical system right away. And, we've had examples of some young people getting strokes like these ladies. In some cases, it's difficult to prevent. For example, the one lady that we showed who caught herself on a nanny cam having a stroke, and we found that she had a hole in her heart. Okay. She had an atrial septal defect. And so a clot went from one side of the heart to the other in her brain. And sometimes these things can happen, but the key is watching out for the symptoms. And then you control what you can control, right? Make sure you have a low cholesterol diet. You try to unclog your arteries. And I do have a video right here on the Dr. Frita YouTube, how to unclog your arteries naturally to keep your cholesterol down. You definitely want to make sure you exercise and stress. You want to keep your stress down. Anyone comment on reasons why they think that these young folks might be getting strokes more and more?
Yeah, a few people chimed in.
Good.
Sheree, she
Hi,
said
Sheree.
cardiovascular events increasing in every age since COVID.
So they're increasing disproportionately in people under 45, like they've increased by 15%. But we do know that COVID itself, while active, was causing increased clotting potential, hypercoagulability, okay, which could potentially have a correlation. But specifically, there's been a bigger jump in people less than 45 proportionately. Okay.
All right. Miss Katrina, hello.
Hi, Miss Katrina.
She says, could it be medication like birth control causing strokes?
Well, I'll tell you, for women, especially women over the age of 34, being on birth control is a risk factor for having a stroke, especially if you're on birth control and smoking cigarettes. That's a risk factor. I don't know if that's the cause for it going up. People have always been on birth control, but that's definitely a good point. Being on birth control, especially smoking, can exacerbate, and that increases the risk for a young person having a clot, which potentially could be a clot in the brain, stroke. Good point.
Jay from IG.
Hi, Jay from IG. Hey.
Says, I think perhaps poor diet eating, inflammatory foods, and exposure to lots of toxins in the water and air, cigarettes, vaping, and poor blood flow from sedentary lifestyles. Now
that's a good one. And we've talked here about ultra processed foods specifically being responsible for a lot of inflammation. And what we're getting now from some of our preliminary studies is related largely to inflammation, but also to stress. Stress, can you believe it? It's believed that stress can cause some dysfunction in arteries, okay, and how the arteries flow. It can cause there to be narrowing, which could lead to an increased risk of stroke. Certainly, though, the diet, sedentary lifestyle, all of these things, if they're being done more and more in young people, can increase their risk for stroke. So I do know that even young adults in their 30s, heck, 40s, will be playing video games like all night long. So are people less than 45 more active before? I don't know. So the research still needs to be done, but these are really, really good points.
All right. And Denise. Hi, Denise.
Hi, Denise.
She says drinking, smoking, and not taking care of themselves.
That's true. And that's true across the board. Increased alcohol puts you at higher risk for stroke. Smoking cigarettes for show because you're increased risk for just about anything. And yeah, if you're not taking care of your life, if you're not exercising, if you're not dealing with anxiety and depression and leading to more stress, that could do it. But yeah, but it looks like specifically in young people, they're looking at stress and working longer hours, more stressful jobs, different things going on in the environment, be it politically, socioeconomically. So they're looking at that right now as being one of the leading factors for young people less than 45 having strokes. But more research is needed, and I'll keep you posted here. But we're about to wrap this thing up with the 5-minute health check. I thank you to everyone who's joined. Make sure you give us a like before you head out of the door. Listen, please go to drfrita.com. That's my one-stop shop. You can go there to book a telehealth concierge appointment. I love talking to all of y'all at the same time. But if you want a one-on-one consult with me, I offer a telehealth concierge service where I can talk to you from anywhere in the world. And we're having a lot of success. I think we got an appointment today, but we have a lot of success with this concierge service where we just have one-on-one. And again, for those of you who are new, I am a medical doctor. I have been quadruple board certified. And so I like to talk a lot about a lot. I read scientific articles, medical journals every single day. So if you do this one-on-one concierge appointment, you'll have a chance to access kind of what I'm thinking. You can run your health problems by me, talk to me about, some questions you have about what your doctor's doing, just to get a different kind of second opinion, another perspective. But we have really good visits. And again, you can contact me from all over the world. And also make sure you check out our podcast, Healthy Happy Life with Dr. Frita. I know you like looking at our faces. But if you just want to listen to some sound while you have it playing in the background, while you folding clothes, while you're jogging, while you're, in the car, then we do have a podcast. You can get us on Apple, Spotify, Google, wherever you listen to your podcast. And once you listen, please do give us a 5-star rating, please, and thank you. So we talked about young people and the increased strokes they're having. We do also know that high blood pressure is a leading risk for stroke. Make sure you check out my book, Under Pressure, A Guide to Controlling High Blood Pressure. I talk about managing blood pressure, not only from a medical perspective, not just traditional medicine, but I also talk about natural holistic remedies for high blood pressure, using food as medicine, lifestyle as medicine, slow, deep breathing as medicine, alternate nostril breathing as medicine, yoga as medicine. We hit it all in that book. So again, you can click the link here or go to my one-stop shop, drfrita.com. And while you're there, please check out my favorite things. I have a juicer I love to use, my Nama J2 juicer. Listen, my daddy has been using that juicer. We were talking last night. He's talking about he's going to get some apples and some kale and some celery, making his green juice down there. Anyway, if you go to my website, drfrita.com, go to my favorite things, I offer a discount code on that juicer. All right, Shador, let's do this 5-minute health check and slide on out the door. Slide to the left, slide to the right.
Is your baby's formula outdated? FDA launches first review in 30 years.
All right, y'all, this is the straight up truth. It has been 30 years since the FDA has reviewed the nutritional value of baby food. And this really started coming back into conversation 3 years ago when there was that baby formula shortage. Do y'all remember that? Oh my gosh, I went on different news shows talking about the baby formula shortage. Where'd I go? I went on lots of national news shows talking about it. If y'all go to my playlist here on the Dr. Frita YouTube channel, you'll see television appearances. You'll see me on there. But yes, the FDA is reviewing it. And so we'll find out pretty soon, hopefully, what is going on with our baby formula. I do believe that 30 years is a little ridiculous. So hopefully we'll come up with something we'll review at least every decade. But yeah, that's the true story.
All right. Is the opioid epidemic finally turning a corner? U.S. overdose deaths fell 27% last year.
Yeah, that's a pretty big deal. 2024, the opioid cause of people passing away did decrease by 27%. And perhaps it's due to an increased availability of naloxone or Narcan, which is the antidote to opioids. I just want us to be very careful because at the same time that we've had this wonderful decrease in opioid deaths, if you take a look at what's going on in Washington, D.C., they're also looking at making cuts in some of the opioid reduction programs, okay? And they're looking to make cuts in some of the programs that have put a lot of education out there about opioids. So while we celebrate, let's also look at what's going on in policy and make sure that you're active in your local government and that you encourage the folks you vote for, your politicians, to keep having opioid addiction and opioid related deaths as a priority. So yes, I'm not trying to poo-poo it. That is great that we decreased 27%, but if we reduce the funding, we might go and be right back where we started.
2 million steps in 30 days. How one man walked for Black health.
Yo, let's play this clip, Shador, as we slide on out the door. This is a good one.
Number of steps taken in 1 month.
WGNO's Kenny Lopez did some legwork to find out why.
Last month, April, I set the world record for the most steps in a single month.
32-year-old Kwame Terra is known as the Big Stepper because in 30 days, he took over 2 million steps, setting an unofficial world record for the International Book of Records.
So I did 2,007,178 steps in 30 days, over 900 miles of walking in 30 days. I walked all over the city. I was averaging 30 to 35 miles per day, just one step at a time.
He accomplished this incredible feat to raise awareness for maximizing health, especially in the Black community. That's why he took his 2 millionth step on Bayou Road, a street lined with Black-owned businesses.
Hey, Diddy. And I just wanted to be intentional about where I walked.
Kwame averaged about 66,000 steps per day, and he hopes his story inspires others, enough to help him raise $2 million for 2 million steps to launch his health app called Bear Health.
Sometimes we need to do something that we've never done to become something that we've never been.
I love it. Okay, that's a good place to end. That's a good place to end. A young man, intentional, doing all of those steps, and particularly to raise awareness about Black health. I love it. All right, with that, Shador, I believe we're ready to slide on out. Before we go, if you haven't given us a like, please give us a like as you head out. Make sure that you follow me on all social media platforms at Dr.Frita. I've listed a few recent like national television appearances. I posted one where I was on News Nation, and I was talking about HPV and how there's now an FDA-approved at-home HPV test as a cervical cancer screening tool. And guess what? It's just as effective as your cervical cancer screening that you would get at a pap smear. We know that HPV is the #1 cause of cervical cancer. If you do this at-home test, TL1, it detects cervical precancer 96% of the time. So it's not released yet. It should be released in June. But if you go to TL1, TEAL, look that up, or getteal.com, you'll be able to find out how to get these tests. So that's some pretty big news. And I talk about that on the national news show, News Nation, that's posted on my IG, my Facebook, my LinkedIn, my TikTok, you don't stop. And then I also post, I posted where I was on WebMD. Have y'all heard of WebMD? I love WebMD. It's also kind of my arch nemesis because I have patients coming in like WebMD versus me, you know, but it does have a lot of good information. And so I was chosen to be one of the medical experts, and I'm talking about caretakers and C3 glomerular nephropathy. So if you go to my IG, if you go to my other social media platforms, you'll see my WebMD video clip. I'm a WebMD medical expert, and I like it. All right. But thank y'all for joining us. Make sure you join the membership because we are going to be having our members only live this month as well. And you'll get to check out these members only videos. Shador, as always, I thank you for being such a wonderful co-host yet again.
You're welcome.
And I thank you to everyone in the chats on YouTube, on IG, on Facebook. And hey, replay, what y'all doing? Thank y'all. Please make sure you comment. We had a whole lot we talked about, but let's keep the conversation going in the comments. I'm Dr. Frita. This is Medical Monday. Thank you for making Monday your healthiest day of the week.